Welcome to Clinician's Notebook by Doc Athena. This is a Country Vet's Technical Diary 21 for free.
What is entropion?
Now let's proceed to case presentation.
Entropion is the abnormal inversion of lid margin that may involve both eyelids and the canthi caused by several factors including anatomical or congenital, cicatricial or spastic abnormalities.
Today, we are going to discuss case number 003, Entropion in dogs.
Patient's notebook case number 003, entropion in Chow-chow. Correction of entropion in a 2-year-old female Chow-chow. Clinical report. For case presentation, on December 10, 2010, patient 003, a 2-year-old female intact Chow-chow, was presented to the hospital with a chief complaint of eye problem. For the subjective part of our medical record, this is the history. Patient had a bilateral entropion with increased secretion of mucopurulent ocular discharge. Other than that, the patient had a normal appetite, urination, and defecation, or EDUD normal. For the objective part of our medical record, here is the clinical examination when the patient was presented. On December 10, 2010, patient weighed 19 kilograms with ideal body condition score of 3/5. For PE or physical exam, normal findings except for presence of neovascularization on both eyes signifying recurrent keratitis. The patient was then prescribed with gentamicin eye irrigating solution. Also, surgical correction of entropion was recommended. With that option, the patient was brought back to the hospital on February 11, 2011 for preoperative evaluation. At that time, patient weighed 14.5 kilograms with a body temperature of 39.4 degrees Celsius. Heart rate was 128 beats per minute and respiratory rate was not taken because the patient was panting. For physical exam, everything was normal except for scabs on dorsal neck area and keratitis. For the laboratory results of the pre-op evaluation, CBC results showed leukopenia with 7,600 cells per microliter for total WBC, with lymphopenia. PCV or HCT as well as the platelet were both normal. For blood chem, ALT was normal, but creatinine was decreased or there was a low creatinine kinase. As such, the patient was then scheduled for elective surgical correction of entropion on February 17, 2011. Diagnosis for this particular case, as obvious, was entropion. This is a photo of the patient prior to surgery. You could notice the eye, which is the main problem in this case. The attending veterinarian opted to perform a surgical treatment with modified hot Celsius technique and Y2V plasty. So on February 18, 2011, the patient was brought back to the hospital for elective surgical procedure. Baseline at the time was heart rate 170 beats per minute and respiratory rate 136 breaths per minute. However, the patient was panting. For pre-anesthetics, atropine was given subcutaneously and xylazine was given intramuscularly. For induction of anesthesia, Zoltil was given intravenously. And for maintenance of anesthesia, gas anesthetics, isoflurane at 1% lowered to 0.5%. Patient was then placed in ventral recumbency. The photo here shows the clipped surgical area and placing of gas anesthetics. Here, an incision for modified hot Celsius technique was done on the right upper eyelid. This shows the left eye of the patient showing the corrected entropion using modified hot Celsius technique on the upper eyelid, and a Y2V on the lower eyelid. This is just another photo showing both eyes with corrected entropion. The wounds were closed using a simple continuous suture pattern for the subcutis and cross-mattress suture pattern for the skin. After the surgical procedure, an Elizabethan collar or E-collar was placed while waiting for the patient to recover from anesthesia. For post-op prescription, 1.16 ml tramadol, canned food, and ad libitum water were given after 5 hours. The patient was confined in the recovery room overnight. After MR, 1.16 ml tramadol and 1.9 ml amoxicillin were given, repeated after 12 hours. The patient was discharged the following day, February 19, 2011, and prescribed with eye irrigating solution. The owner was advised to clean the wound with povidone iodine and apply with guava cream. Moreover, the client was directed to return the patient on March 4, 2011 for follow-up. As such, patient was brought back to the hospital on March 4 for follow-up, and during that time, the wound was already healing and the patient was apparently normal. The sutures were also removed at that time. For recommendation, administration of local anesthetic to remove the spastic component of entropion for more accurate surgical planning and correction of the condition could have helped as well. For references in this particular clinical case, which was presented in 2011, I would like to thank the following: Alguer I, Bedford P, Ross S.L., Giuliano E.A., Herrera D, Hinstich C, Jones S.M.P, Can C.M, Komaromi A.M, Offrey R, Plum T.C, States F, Verheller R.C, and Linux W.J. Thank you very much. That's it for our clinical discussion about case number 003, Entropion in Chow-chow. I hope you learned something from this lecture. Thank you for listening to Clinician's Notebook by Doc Athena. I hope to see you again in your next lecture. Please take care, everyone, and God bless us all. Bye!
That's all, folks, for our clinical discussion from Clinician's Notebook by Doc Athena. I hope to see you again in our next lecture. For those who have not subscribed yet in our YouTube channel, please do so. And if you have any questions, please leave them in the comment below, or if you want a private conversation, you can send us a message to Doc Athena Facebook page. Please keep safe, everyone. God bless us all. Bye!